Good afternoon, everybody. Welcome to our COVID-19 update in Eau Claire County. We're glad you joined us, and we're glad the media is here with the questions that you have so that information can get out to the public, and we're glad that everybody else was able to join as well. Today is December 30th, 2020. It is Wednesday, a little bit of a different day than we usually come and do a briefing with you. Because of the holiday coming up, we are doing it today. It does mean we have a bit less data available to us. The state typically posts data later in the day today that we share on usually on Thursday, but we will share what we have today. And it gives us a chance to update you about things that are going on before the holiday starts. Next week, we'll return to our regular Thursday briefing time. And this is our last media Q&A session of 2020. So again, thank you to all of you in media that have been working with us to get messages out and that have been willing to participate in this media briefing process. A reminder again that like last week, our data is a bit different because it's data that only goes through yesterday rather than data that is through Thursday. We'll be making our usual metrics reports, those reports that show the red, yellow, and green. Those will be updated again this week, but it'll come out after this briefing, probably sometime tomorrow or Friday. Please check our website and that information will be there. You can click on the data tab and get a lot of good information, including the metrics update as that gets updated. We also will be sharing our situation report. And for those of you that are not aware of that report, it's something that you can access online on our COVID-19 Eau Claire website. The situation report comes out once a week, and it's a place where you can get a good summary of what's happened during the week in Eau Claire and across the state. We also have a few national updates there as well. Quick summary of data and an overview of some of the bigger things that happened during that week. There is an e-notification process, so if you sign up for that on our website, you'll get sent that situation update every week when it comes out. 2020 has been a memorable year in many ways. The start of 2021 this week doesn't flip the switch for COVID-19. I wish, in our wishes, we probably will have that this year, but it won't happen. But what can happen is a new commitment to working together to keep one another safe and healthy. This is an odd time. We have a lot of things to reflect on from 2020, but I hope it also inspires us to step into 2021 positively and with energy to really walk through what we have ahead of us. We continue to need everybody to work together to find ways to create a healthier Eau Claire. So I'm really counting on all of us to find ways to do that this coming year. Today we'll walk through the data, some of the Eau Claire data, some of the state data, a couple of updates, and then answer a few of the media questions that came to us in advance. We will, as usual, have Audrey help facilitate questions that come in via the Q&A box from the media, and then open it up for media questions at the very end if you have those. So basic data. The number of positive cases for COVID-19, the number of individuals in Eau Claire County that have been tested and found to be positive are now over 9,000 Eau Claire County residents. We're at 9,182 Eau Claire County residents that have tested positive. It's about an average of close to 40 cases a day that we are now at. For the last 7 days, we're at 39 cases a day. Good news is that case number per day is going down, and we really are counting on that continuing. Our goal continues to be about 10 cases a day, and that number makes a big difference for community spread, for the way that our hospitals can respond if they need to respond, and really for our businesses and schools to stay as operational as possible. The fewer cases we have, the more likely we have more people that are not home because they are close contacts or that because they're infectious, and staying home from school and work and other things that they want to enjoy. So again, the 39 cases is much improvement, and we have some work to do to get to the place where we need to be. All parts of the county continue to be impacted and all age groups. Again, you can see on our website some more extensive data there about our positive cases of COVID-19 in Eau Claire County. Active cases, we're at around 330 active cases that we are working with. Those people are currently infectious and are currently staying home. We are working with them to do that and to identify their close contacts and make sure that those close contacts stay home for the full quarantine period. 12 more people were hospitalized since last week. We now have 292 people that were ever hospitalized during their COVID-19 time. And we now have 75 Eau Claire County residents that have died related to COVID-19. A really large number of individuals and families impacted in that most significant way. 4 more people since last week, Wednesday. It's a slowing rate of number of deaths, but it continues to be at a very high rate compared to early in the pandemic. Eau Claire weekly data that we share with you typically, our jail testing data as of Monday, December 28th is at 379 individuals tested. 26 individuals connected to the jail have been identified as positive and 23 are recovered. UW Eau Claire affiliated cases are now about 15% of the cases that we've had since the beginning of September. There are currently 64 active public health investigations in Eau Claire County. Again, this is a considerable number of work sites and long-term care sites that are actively right now dealing with COVID-19. Our goal continues to be that we don't have those settings having to deal with either individuals living in those settings or individuals working in those settings having COVID-19. About 2 in 3 of those settings are either education sites or work sites, and 1 in 3 is a long-term care facility. The state rating for COVID-19 in Eau Claire County is at very high. It continues at that very high level. That means at least more than 360 cases in 2-week period is what is considered very high by the state measure. We've had over 500 cases in a 2-week period, so we are well exceeding that threshold for very high. And we continue to have the goal to get under that in Eau Claire County. Our goal is actually 150 cases in that 2-week period, or 75 cases in a week. So again, we're working hard to get to that 10 cases or less in a week. The remainder of our metrics, again, will be made available on the website, so please look at that. Those are our red, yellow, and green measures. Last week, we posted those measures after our briefing, and you may have seen those. We hope you did. We do have some improving measures, and that's good news. We're hopeful this week that we will also have some measures in the green and in the yellow. Previously, most of those measures were in the red for a number of weeks. We have work to do, but good news is that some things appear to be flattening out or improving. A reminder to everyone that since we last talked last week, we had a holiday for many in Eau Claire County. So our testing data will be impacted, our case numbers are impacted. We know that the holiday makes a difference in our data. So do be aware that both this week's data and next week's data will likely be impacted by those holidays. A couple of state data points for you. We have more than 475,000 people that have been infected with COVID-19 in Wisconsin. We are now at 477,292 individuals, almost 14,000 more people since last week, Wednesday. Hospitalized people are about 4.4% of those that test positive. Or more, almost 33,000 people in Wisconsin that have been hospitalized. In the state activity rate is very high, the same as the Eau Claire activity rate. Again, some improvement, but ongoing challenges because we're remaining in that very high level. In our state, 4,818 of our Wisconsin, again, family, friends, neighbors have died related to COVID-19, an increase of more than 200 people since last week, Wednesday. A reminder that many people in Wisconsin celebrate the Christmas holiday, and that means that those families and those neighbors were suffering even more significantly there during this time. It's hard enough to have all of the things going on that are going on related to COVID, but to have family members die related to COVID is certainly, especially during this holiday time, an enormous burden. And I think we all need to pause and think about that. It is good to see that our numbers for hospitalizations appear to be going down. They are fairly flat in this region right now. And we hope that that continues. That will likely mean that our deaths start going down. A couple of announcements happening statewide as well as locally. Probably the big news the last number of weeks has been about the vaccination process as it moves forward across the nation and across our state. Again, in Eau Claire and across Wisconsin, local healthcare workers continue to be vaccinated for COVID-19 through their healthcare employers. That has been the priority as the first vaccine is rolled out. The state receives vaccine and then has been sending it out to vaccinators that have been approved by the state. And most of those vaccinators right now are vaccinators that have large healthcare systems. So those healthcare workers are prioritized to receive vaccine and are the ones that right now are in line to get that. We call that the 1A group. It's the prioritized first group, and 1A is the first priority in that group. 1A individuals are those healthcare workers, those individuals in long-term care settings, both residents and employees. And they've been prioritized because they have the closest contact to COVID-19 and the highest risk of hospitalization and death related to this disease. We know in Eau Claire County, our healthcare system partners are working hard these past weeks to vaccinate their staff, and they've been doing a yeoman's job. We got an update this morning in our incident command meeting that is moving forward, and they are working hard to get their teams vaccinated. They've also been able to help support vaccination of some of our EMS workers that don't directly work for those healthcare systems, but are critically important in transport and care of individuals that have emergencies. So those EMS workers have also been prioritized in Eau Claire and are starting to get vaccine this week. A reminder that the state is in that lead role to take the vaccine that is received at from the federal government. So again, the federal government decides how many doses of vaccine come to Wisconsin. The state is responsible for making decisions for dispersing that vaccine across the state. That is currently going to approved vaccinators in Eau Claire County. Right now, that 1A group is the priority. It includes healthcare workers broadly defined, so those people that work in hospitals and all other healthcare and health-related settings. There remains to be a small amount of vaccine received in Wisconsin to date to cover the more than 500,000 healthcare workers that exist in this state as estimated by the state health department. But as more vaccine becomes available, more vaccine will come locally to get to those healthcare workers that are on our local 1A group list. The state also this week announced a partnership, and it has been talked about previously, with Walgreens and CVS. This is a federal partnership to partner Walgreens and CVS sites with long-term care facilities in locations across the U.S. In Wisconsin and in Eau Claire, that partnership has happened, and there have been assignments made to long-term care facilities broadly across our community. We are working with the team that has developed that list at a state and national level to make sure that everybody's on it. And the state announced that Moderna vaccine, one of the two vaccine types, is now available in the state and is being prioritized right now for our skilled nursing facilities. Those are those facilities where the highest level of care is needed for individuals. So they are starting with that group. Other types of long-term care facilities will be in the queue after that. It is a statewide effort to get vaccine efficiently and effectively to one of our highest risk settings, that long-term care setting. The state is doing a lot to get vaccine out, but there's also an enormous local role, and we continue to learn about how we are partnering with the state to get vaccination to happen locally. It's a process, and even this week, we are having more conversations every day with our state partners about how that will happen. Some of the work that's happening locally, just for all of you to be aware of. First of all, we do have a team of organizations that have put forward their name to the state to be vaccinators for COVID-19. We already know about many of those because they've been talked about in the media. Those are our key healthcare organizations, but others also have come forward and said that they will help with the vaccination effort in Eau Claire County. The health department would be an example of one of those additional providers of vaccination. So we are working with all of those partners that have indicated a willingness to the state to vaccinate for COVID-19. And we'll be working together to make sure that we can, as efficiently as possible, get vaccine into arms for those individuals starting in this 1A group and progressing through the prioritized groups as we get through the winter and the spring. We also are working hard locally to make sure we understand the who in each prioritized group. For example, the 1A healthcare group has many, many people in it. It certainly includes all of our hospital systems, for example, in Eau Claire County, but it also includes all of those clinics and offices that provide some type of healthcare service that may not be affiliated with a large healthcare system. So as you can imagine, all of our dentist offices, all of our chiropractic offices, all of our eye clinics, all of our primary care clinics that are not affiliated with a healthcare system, and many, many, many more groups and organizations that may not otherwise be connected to a Mayo, Marshfield, Prevea, Oakleaf, but are providing services that are eligible to be vaccinated under this 1A grouping. We right now, as an incident command team, are collecting all of the information on who all those 1A sectors are and who are all the entities within that sector in Eau Claire County. We have a very long spreadsheet for Eau Claire County, as many of you can imagine. We also will be adding to that spreadsheet a lot of additional information through a tool that will be on our website shortly, maybe as soon as this afternoon, that will be a survey for our 1A providers and eventually all of our entities in Eau Claire County to go to complete the survey. So we have good contact information for all of our organizations, and we have a clean and easy way to communicate with you as we have vaccine available in Eau Claire County. We'll be getting more information out to all of those individuals in that 1A grouping, so those organizations that fall into that 1A grouping. We will be actively reaching out to you in the next several days or over the next week. But we also ask all of you to go to our website as organizations and look for that link and fill out the survey so that we are sure we have captured everybody on that list. We want to make easy connections with all of our organizations and facilities that are providing 1A eligible services and need to get vaccinated. We also encourage you to be having conversations within your organizations about the opportunity to be vaccinated as part of this first tier. We will soon hopefully be moving into the next tiers that have been identified in the state plan. So the 1B group is considered the essential workers group. We do not yet have a clear definition from the state about who will all be included in that group. We hope to have that early January, and when we do, we will also be strongly encouraging all the 1B organizations to, again, go through the same survey process. You can do it now, but you can also wait a bit. And we will be populating a, a full inventory of our 1B entities in Eau Claire County as well. So again, we can quickly prioritize and reach out to you as we have vaccine available in this community. We're also working right now to get through our 1A list with all of our vaccine providers. So we had a meeting yesterday, and we are working together to make sure that we are not duplicating efforts, but coordinating so that we can get all of the prioritized groups vaccinated by all of us that will have potentially vaccine in the next weeks. In the health department, we are also planning our own vaccination clinic. So we will be one of the providers. We will be starting next week, we hope, to receive vaccine, and we will be reaching out to specific entities to provide vaccine to them as we receive them. Again, we will find out more from the state probably this weekend about whether we will get vaccine if they have enough. And we will be working directly with 1A providers in getting vaccinated. We're also spending time, and it's critically important that we provide good information on vaccination. So our website continues to be a really important place to go to get more information. We will regularly be updating that as we learn more from the state. And we'll be really encouraging people to learn about vaccination and ask questions. This is a new vaccine. We are really excited that it is moving forward and starting. I've told many of you I'm looking forward to the day when I will be able to be vaccinated, and we need to really be working together to encourage this as an important strategy in this community to help all of us be safer. We want school and businesses and work sites across our community to have the opportunity to have vaccinated workers and students and employees, and we can work together on making sure that there's energy and enthusiasm around that. So it's also a reminder that we don't have a lot of supply right now. So we need you to work with us to understand that patience and pace, two words that I heard on a state call this week, are important. We will get vaccine. It will be slow to start with, and we will be getting vaccine in arms in Eau Claire County, but we also want you to know that we are doing it as quickly as we can as we get supply, and work with us on that. The state is now publishing every Tuesday data on their website about the numbers of vaccinations that are given. We are now at over 47,000 vaccines that have been given in Wisconsin as of, I believe, yesterday. And that will increase every day, but they will be posting regular data updates about vaccines given on the state website. We hope that eventually there will be an easy tool for us to similarly do that for Eau Claire County residents. We're not at that point right now. So testing continues to be also one of the really important strategies that we have in Eau Claire. Our testing volume has gone down, and we encourage people to continue to see testing as a really important way for us to slow down disease spread. During these next weeks, so last week and again this week, we have fewer testing sites open because of the holiday. Please check our website to be sure you know which ones are open and when. Again, if you go to our website, you'll see the testing options in the testing tab. Again, our website is covid19eauclaire.com. It does have updated dates and times there on the symptoms and testing tab. The antigen testing site that UW Eau Claire has been running at Memorial continues to be temporarily closed, but will be starting back up next week. And please check our website for ways to register for that location. That location, antigen testing, is for those people that are not symptomatic, but may be high risk for other reasons. So do consider that site if you are high risk and are non-symptomatic. A reminder on quarantine. It's been several weeks since the state announced shorter quarantine options for those people that have been exposed, that are considered close contacts, but can also meet some additional requirements. So it's a both and, exposure and can meet some additional requirements. We want to remind you that the safest option continues to be 14 days. For those that are able to maintain those basic mitigation strategies, distance, of 6 feet or more at all times, wearing a mask whenever out in public, all those basic strategies. And for those people that remain asymptomatic, there are additional options available. Again, you can look at our website for more information, but we need to make sure that people understand that it is not just a 7 or 10 day option. It is a 7 day plus testing and plus all of those mitigation strategies, or a 10 day and all of the mitigation strategies. We encourage people that are close contacts. We continue to encourage people that are close contacts to get tested during their quarantine period. If you are positive for COVID-19, we also want to remind you that answer our phone call, work with us. It, in the end, is the quickest and easiest way for us to slow spread of disease. We continue to have people that choose not to work with us, and that does make things much more difficult as we try and do our work to make the community healthier. So please answer your calls and work with us. To close, I just want to wish everybody a happy new year. 2020, as I said to start, has been an unprecedented year. We probably have many ways that we are going to be reflecting on all the problems and challenges of 2020. I think that might be natural. I'm going to push myself hard, and I hope you all push yourselves hard to do some reflection on the positives that have happened in this year. I know I have many things to be thankful for. Particularly, I want to call out during this last media briefing, our incident command team and particularly our health department team. They have lifted an enormous burden and worked together in ways that I can't even have imagined back in March. And I am incredibly thankful for how our whole community has pulled together to really say, we can do this, we can support each other, and we can make the hard work happen. So I see so many reasons to be thankful for the very positive things that happened in 2020 as well. I hope you find those things to be thankful for, and really start 2021 with that frame of mind. We'll go through a couple of the previously submitted questions from the media, and then we will take some additional media questions if they've come in through the chat box, and then we'll go to additional questions if people have them. So the first question is, early this year, hospitals said they were either at full capacity or nearing full capacity. Where are we at now? We again don't have the final metrics that are announced weekly by the state available today, but we do know from the regional metrics that are shared with us on a daily basis, and I got right before I came into the media call today, that our numbers remain fairly flat for hospitalizations in this region, including Eau Claire County. Our ICU beds remain somewhat concerning, and we're watching that, but certainly as our flattening numbers and hopefully soon to be decreasing numbers of COVID-19 positive cases in hospitals, if that continues to flatten or go down, that is really good news. So we will be watching that. Again, staffing challenges remain. Those individuals that are staff that are also COVID positive or have to quarantine because of close contacts, those do create challenges in our healthcare systems. So again, as a community, if we can slow down spread, those staff people also have less likelihood of becoming positive themselves. We will continue to watch hospitalization rates carefully. We also got a question about the obvious New Year celebrations that typically we often have over New Year's Eve and New Year's Day, and whether we're concerned about those celebrations. Absolutely, I'm concerned about that. We have been messaging about that regularly. Both the Christmas holiday, other winter holidays, and the New Year holiday are ones where we as human beings like to get together and have celebrations. It's important for us to do that. I strongly encourage you to find ways to do that where you are remaining with your household and interacting with others via media, via other avenues. We know that's hard. We know it's going to be odd this year, but it will make a difference if we keep the close contacts minimal and we don't gather in groups. We don't want to see a spike, a week to 10 days after New Year's. And we're hoping that while our case numbers the last couple of days have been closer to the 30s to 50s, we hope that that number doesn't continue to creep up. So we're counting on you to keep the numbers flat and to continue to go down. Our recommendation continues to be to not gather in groups more than your household. So Audrey, do we have additional questions in the chat box?
Nothing in the chat box today. Would anyone like to unmute and ask a question directly?
Hi.
Go ahead, Katrina.
Hey, Lisa, I just wondering, do you know if bars are open for 24 hours on New Year's?
So I had a really difficult time, Katrina, understanding your question. I apologize. Is there a way that you can type it into the chat box so Audrey can read it to me?
Yeah, Katrina's asking if bars are open 24 hours on New Year's.
So thanks for that question, Katrina. I actually don't know the answer to that question, but it's certainly something that we can get more information on and share that. We have been working with all of our businesses to really talk to them about how they play a role in keeping holidays safer. So my hope is that again, all of our business partners are considering that. I'm not certain about plans for holiday hours across Eau Claire County. All right, with that, with no additional questions, I will just say again, thank you to the media that has been on this call and for helping share messages across Eau Claire County. A reminder of our COVID-19 website, covid19eauclaire.com. If you have questions that are not answered via that website, please call our call center. That number is 715-831-7425. Again, have a safe and healthy end of 2020 and start of 2021. We'll be back next week, Thursday, January 7th.